Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Scher, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Welcome to another episode of Reinventing the White Coat. Today, I have a very special guest, Dr. Foluso Fakorede. He is an interventional cardiologist and founder of Cardiovascular Solutions of Central Mississippi. Dr. Fakorede has somehow managed to integrate interventional cardiology with preventive medicine and political activism. He is an advocate to end racial health disparities as they relate to peripheral artery disease. He takes care of patients individually in his community, is an agent of change on the national level, and in 2020 was honored as one of the Route 100's most influential African Americans. So wow, I'm really honored to have you joining me today.
Thank you, Jennifer. It's an honor to share the stage with a colleague, and also appreciate your plight in this field of medicine. As an esteemed physician, but also as a friend in trying to raise awareness on what our colleagues are doing and how to help our colleagues in general just, live a better mind, body, and spirit fulfilling lifestyle. That's what we're trying to do, right? Trying to accomplish. So honored to be on the stage and honored to be on your show today.
Oh, thank you so much. So listen, I am exhausted just hearing listening to all the things that you do, and yet somehow you seem to be truly flourishing.
Yeah.
How do you manage to sort of keep your passion going? I mean, am I right, or are you at the end of your rope?
I mean, you're spot on. I mean, it's today's MLK Day. It's a day of service. It's a day where, I always tell people, out of despair comes a beacon of hope. And I usually quote that despair is a poor chisel to carve out tomorrow's justice, and that justice could be in healthcare and educational advocacy. It could be economic advocacy. But for me, I think the journey all is deep rooted in terms of my background and the shoulders in which I stand on. One being my parents. My parents are immigrants who came to the States with the mindset of trying to make sure that the kids had the best opportunities available for them to attain the best educational system. And for my mom, that meant working 3 jobs as a registered nurse, in addition to other things that she had to do. My mom was a registered nurse, a gas attendant at a gas station, and other things as well. So that mindset is can do mindset, 1, and perseverance, 2. 3 is faith. We have deep-rooted faith where you believe that the favor of a higher power is over you, so you can persevere and also flourish. And I think every educator that has been instrumental in getting me to this phase that I'm in right now, from New Jersey, Teaneck High School to Rutgers University, to my medical school mentors, to every attending that trained me while I was at Cornell. Shout out to Cornell internal medicine residency, and also my cardiology and interventional cardiology fellowships. All those folks who had given me the tools that I needed in the toolbox, I think gave me everything I needed to come down to an underserved community here in the South, and trying to figure out how to navigate, not only as a leader, as a CEO of a practice. We didn't get that training in med school, but also as trying to utilize that platform to become a megaphone for those who suffered from what I felt was a virulent preventative epidemic It's a preventable epidemic of losing your limbs and ultimately losing your lives and livelihood. And so I think that's where it all emanates from. And then so to also, how do you maintain that daily, mental acuity, sharpness, whatever you call it, or hope. I think it's in the patients we treat. For every time you feel that your feet is getting tired, or your mind might be getting tired, you meet a patient who says, "Please, don't let them cut on my leg," and then that adrenaline kicks in.
Yeah.
Or like, you know what, I'm gonna fight for you.
Yeah.
And if that fighting for you is not only my technical competence of restoring circulation of blood flow, but getting you the best wound care specialist, teaching you how to be a better nutritional counselor for yourself, hooking you up with a community navigator in terms of addressing some of your social needs at home, and then taking that to advocacy levels and advocating for policies and addressing some of the disparities in treatments and cares and social determinants that have led to where we are today.
Yeah.
So that's
Is
that's
it,
kind of the circle.
did I see you say something about, is it actually true that on MLK Day, I can't believe I even have you on this day. What a gift. That it's more likely that to end up with an amputation, less like if you're white, you're less likely to have your leg cut
Yes,
off.
yes. So if you're a black patient in this country, you are twice more likely to have peripheral arterial disease in terms of the prevalence. 30% African American versus I'm sorry, 30% African American versus 15 to 16% Caucasian in terms of prevalence of the disease. And that's just buildup of plaque and cholesterol in your arteries. And then ultimately, if it's not screened in a timely fashion, treated in a timely fashion with medicines and guideline therapies that we have that many patients cannot afford or are not, exposed to or prescribed.
Mm,
Ultimately, what happens is that you get to a point where you're oxygen deprived in terms of blood circulation, right? Once you
hmm
lose that oxygen, the flow to your leg and that blood supply to your leg, a wound evolves and that wound becomes non-healing because it's not getting the good and rich nutrients it should get. And then you're 3 to 4 times more likely to be prescribed an amputation first strategy if you're a minority compared to your white counterparts. So what does that mean? It means that, ultimately when you see a wound, you can actually restore circulation and do what we call an angiogram or do a bypass surgery, and that restores circulation to the foot in addition to the medicines. And you give it time to heal, and then you get them to a great wound care specialist, and you get their sugars under control and all their risk factors. Well, that takes a community of doctors. That usually works for folks who either live in zip codes that are either of medium to higher wealth,
hmm
predominantly white communities. But in Black and brown communities, we don't see that. We see an amputation for a strategy where they're prescribed to have an amputation. And ultimately, once an amputation occurs, any amputation above the ankle and or above, we call that a major amputation. If you
hmm
undergo a major amputation in this country, particularly if you're a diabetic, who actually undergo most of these amputations, 65% of all amputations every year, what you see is that 80 to 85% of them will be dead in the next 5 years, actually 50% within 2 years.
Now, did
So
you
it's
see
not,
that?
it's a death sentence. It's a
Yeah.
death sentence.
Now, did you see that same scenario pan out when you were working in New Jersey, or is this
No,
unique to the?
absolutely not. So here's what's interesting about New Jersey and what I saw in Jersey. I saw the impact of social determinants, right? I trained in both New Brunswick, New Jersey, which has an underserved population, but predominantly most of my time in New Jersey was spent in Camden, New Jersey. And let's mirror that to where I did my residency, which is the Upper East Side of New York, 69th in New York. So talk about polar opposites.
Mhm.
Um, so in Camden, New Jersey, we did see social determinants. It's right across the bridge from Philadelphia. But the prevalence of diabetes was not as bad as here. The prevalence of obesity was not as bad as here. We had more available specialists. It wasn't what we call a specialty or medical desert as it is here. And so what you see here is you see compounded the highest prevalence of risk factors, the diabetes, obesity, high blood pressure, you see the lowest number of physicians like you and I, right? Lowest number of physicians in general, lowest pediatrics, lowest cardiologists, endocrinologists, wound care specialists, nutritionists, orthopedics, vascular surgeons, interventional radiologists, interventional cardiologists. So the whole family of physicians that it takes to create what we call a multidisciplinary team is missing.
Yeah.
And so it's a desert that has the highest prevalence of all these risk factors and the lowest number of, folks who can help you out. And so ultimately, you see higher rates of complications.
Yeah.
You see the higher rates of wounds. You see the higher rates of amputations. You see the higher rates of, heart attacks, of strokes, which are consequences of actually poor circulation to your legs. There's a 4 to 6-fold higher chance of having a heart attack or a stroke. And so it's how do we address all those things that we just laid out in the last?
Yeah, and I never actually heard the term medical desert before meeting you. I've
Yeah.
spoken with people who have gone, but I've spoken to many people who have gone on medical missions.
Mm-hmm.
And it seems like you're on a medical mission on a daily basis right here in our own country. I mean,
It's funny. It's funny you meant that because you and I have never had this discussion in terms of medical missions. But when I was younger, up until age 13, I lived in Africa. So I'm well familiar with medical missions and those who came to actually provide such valuable and noble services. I tell folks when they say describe here, I say it's the similar experience in terms of the medical experiences that I've seen in third world countries, only the exceptions of having electricity on. So this is on. And we have paved roads that are better than they do in Africa. And the educational system is probably not as interrupted with strikes, but everything else is the same. The life expectancy is equal, just as bad. I mean, for what we spend in our healthcare dollars, I mean, we rank low compared to all other, Western nations that spend insurmountable amounts on healthcare. I mean, we're one of the top healthcare spenders, but our health mortality is not in the top tier at all. Cuba, for crying out loud, spends a third on its healthcare system than we do, and they have a better mortality rate. For a Black man who lives an hour from me, their mortality, their mortality rates in terms of their age, is about 62, 65, which is unacceptable.
mm-hmm.
I mean, we shouldn't have folks dying in their low 60s and late 50s. And so why is that? It's because we have the lowest number of physicians per capita. We have, the poorest metrics in terms of social determinants of health, education and transportation, healthcare, housing, economics. And then let's topple that with, structural inequities and racism that occurs. So that all factors into why we have the results we have. And the lack of upstream preventative measures that we need to do a better of, not only training our trainees, but also implementing that across the board.
All right, so I guess this is a two-part. How did you make the jump from you started in Africa, you went to New Jersey, now you're in Mississippi, and I mean, clearly you are passionate, you are connected to the work that you're doing. How do, we encourage more people to make the move you did?
Yeah.
What's the call?
Well, it's twofold. I think one, it was, there was a need. When you're in training, you see a lot of maps in this country, and we call that, heat maps. The heat maps in terms of the obesity, heart attack, stroke rates, and peripheral arterial disease rates in this country always were predominantly here in the South, which actually overlaps the unfortunate history of the South, where you see enslaved populations were predominantly the South. That's why we have a predominantly Black census scope, meaning the highest prevalence of Black people in this country are here in the South. So it wasn't a shocker to me that where you see predominant minorities, particularly Black patients or Black people, had highest prevalence of all these cardiovascular diseases and outcomes. That was not a shock to me.
Mm-hmm.
What was shocking is that as a physician who makes up 6% of the population in healthcare, because there are only 6% of Black doctors, but someone who had all the training and the background, it was easy for me to make the easiest decision and stay up north and just be comfortable and be a small fish in a large pond and be amongst other specialists and all fighting for the same pie versus saying, okay, why don't you go down to where your services are needed, where there's concordance between you and the patient population. 80% of my patients here look like me and look like my mom and my dad and my brothers and sisters, and who need someone to help them navigate this healthcare system.
Yeah.
Because it's not just navigating like, hey, listen, just come see me and I'll take care of your problems. It's educating you, inform to transform, about how you got here, what you have, the insurance that you have, because there has to be some insurance literacy. Some patients think they can just walk in and just like Burger King, have it your way. I wanted to have my initial evaluation, my stress test, ultrasound, and my legs fixed all in one day, and I want to go home.
Right.
Doesn't work that way. You and I know that it doesn't work. So if you don't sit them down and talk to them like you would your uncle during Thanksgiving dinner and say, "Unc, you're crazy. This is not how it works. So let's have a drink of water and talk." And that's the conversation, right? And it's doing that, but then taking it to the community level and going out and saying, wow, we need to cut down on the sweet teas and the sugary drinks, and going to the schools and showing them like, hey, listen, there are cool people in this world who are not athletes. We can be doctors, we can be nurses, we can be techs. And so just infusing that energy and that passion too, and that hope into different facets of the community, and participating in community events and civic organizations. And so that became a groundswell of trying to address some of the preventable strategies that one can take when you hear of medical deserts. We always think of the weaknesses, and the weaknesses being the disparities, and the poor outcome, and the fact that they have, vulnerable hospitals where there are counties here that don't have hospitals, but also their strengths. There's strengths in doing that. And, it's the resiliency in the community. It's making sure that, you can create your own little, hope. You're a hope dealer. So you're creating your little beacon of hope for them.
I love that. Yeah.
Yeah. And that's a mixture of your technical and interpersonal competency.
Mm-hmm. Yeah,
And
but do
then
you have a whole team?
yes, yeah. So
Okay.
you have to build a whole team, and that's not built overnight. For me, that took me about, the practice now is almost 10 years old. So it took about 3 to 4 years to really understand what a practice entails. For anyone who wants to build a practice, I always tell them it's not taught in school, and you have to understand what it takes to build a
Right.
practice from the financial, from clinical standpoint, emotional standpoint, but also understanding the business of medicine and keeping up with the business of
Yeah.
medicines, and all the policies and billing, and what billing is and what coding is and all that. But I think for me, I was blessed to try and figure out who those people are and empower them so they can lead me, right? My job as a leader also sometimes is to give away that leadership
Yeah.
title to others who can steer me in the right direction, while I handle what I need to handle. And what
Yeah.
I need to handle is to make sure that everything in the best interest of my patients are met, to be their megaphone for them, both locally, regionally, and nationally, and to take this message out of here to the national pulpit and demand answers and better results for these folks who did not have that person to be their, to be their advocate. I mean, that's what it is. And then that's what has fueled me repetitively over the last 10 years. And that's why I came here to the South.
Yeah, go for it. I mean, it's so inspiring. I ask you one other question about your model, and I think, because so I work in New York, Long
Yeah.
Island, anything as far away from a medical desert as you could probably imagine. Although
Yeah.
I'm all the way on the eastern end, and it's quite a bit of farmland, and we have a huge immigrant population, and
Right.
I feel like I am, what do they say, drinking from the fire hose at times, being able to try to help, the medical piece of what my patients need is really a
Yeah.
small piece of
It
what they need.
is.
It's connecting
It
them
is.
with the food pantries and the
It is.
resources, and it is overwhelming. And we're in a system of fee for service where
Yes.
we only get paid for the patients we see. It's incredibly challenging to build that team around me.
Yeah.
Um,
Time. And it takes time. and it's what time you have in the course of the day. I mean, you're scheduled to see, hey, how many patients do you have to see in a day, in addition to addressing these problems? And for me, here's how that worked. So I had to see patients, do procedures, and when I'm done at 6 o'clock is actually when my time really starts. So at 6 o'clock, you will find me. This was early years when I started in 2015. Between 2015 and 2018, 19, there's not a weekday where I did not have at least two events on my calendar where I'm in a community event or church event or civic event around that region. So what it did two things, Jennifer. One, I had to learn the strengths and weaknesses of this community. So even though I'm a Black physician, remember, I didn't grow up in the South. I
Right.
grew up in Africa. So I had to understand not only the language, the history. I knew the history, and as a student of MLK himself, I mean, it just, but everything is surrounded, but the history of how people think and some of the pain they endured, but also who were the navigators I could work with, the community leaders I could work with to help me and get me in front of the folks that I needed to talk to.
Mm-hmm.
And so doing that for 3 years helped me establish community navigators that I could delegate some of those things to,
Yeah.
that might have been challenging for someone like yourself up north. That takes time,
Yeah.
and those things don't come to you if you don't seek them out. And you feel like we work in silos, right? It's like, wow, I'm trying to do this. I'm trying to seek help for my patient. I don't know who I'm trying to connect them to, and that person is working in a siloed environment. So it's like, what's the connectivity, right? And so the interconnectedness is easier, I think. One of the strengths of actually underserved communities, that interconnectedness is easier to get done here than it is in a larger city, larger urban community.
Yeah, I could see
Because
that.
everyone knows everyone here.
Right, right. Yeah. But it all comes down to it takes time and it takes work, and you have to be deeply connected to your big why, right? Or
Correct.
if you want to call it dharma or
Correct.
ikigai or
Correct.
purpose or whatever it is.
I still go why your purpose, but you're right. You're right. Absolutely. You have to, because ultimately that is what your building block is, right? That is
Mhm.
that is why we are having this conversation today on a holiday. It's the backstories of, I think, what fuels people in terms of their commitment to healing others is if you've had a personal experience where a family member was either sick or you lost someone in the medical community, or you lost a family member due to errors, um, or if you've just seen people who walked into your office who you took care of, or someone that you treated. I've had a gentleman who I restored circulation to his feet on the Thursday. I flew to New Jersey on a Friday to see family. I came back Monday, and the general surgeon at the hospital, amputated his legs that
Oh,
Saturday. And so stories like that,
mm,
right, are ingrained in your memory
yeah,
as to who was his protector at that time,
yeah,
and what could I have done differently, or actually, you know what? I just need to be around. This was the fork in the road I had to deal with, to be honest, my first few years here, because there was a time where I said, well, things are a little bit different in the South. I'm not exposed to a lot of, the things that I was accustomed to up north at first because it's in a rural environment. So like Starbucks, you want a Starbucks, you got to drive an hour and a half. You want a good movie theater, you got to drive. The
yeah.
closest airport is 2 hours away. You're not used to those things, and the heat is a whole different ballgame. And
I
so it's
bet.
like, all right, 2 years in, are you gonna stay or are you gonna leave? And you're in the fork in the road. But when you start taking some of the things you learn and documenting your amputation rates and seeing how you're decreasing amputation rates, and we were lucky to have documented how we successfully decreased amputation rates by 88% over a 4-year period, that gave me a platform, but also that brought people to the table that usually would not be here. So that brought academic noise, that brought some media noise, and I'm like, okay, what are you going to do with that? So going back to the civil rights era, Martin Luther King himself used the power of the media and the power of, bringing together people from different sectors, both black and white. The power of making sure that, we had a voice in terms of connecting both educators and the healthcare navigators and people who dealt with housing. And he had a poverty march that he put together for ground. So just we all call that today social determinants.
Yeah, right.
Right, right.
Rebranded.
So but yeah. So it's when you see the weak and you see people prey on them, or you see that, hey, they're not informed to be transformed, or they don't know what they don't know, as we say. It's how can I be a better version of myself every day to make sure that I stay in my why, I educate, I inform, I advocate, I empower, and I stay mentally sharp for myself as well, because
Yeah,
you got to be healthy to continue to do these things both physically and mentally.
100%, 100%. That's a great place to sort of wind this down, I think,
Yeah,
taking care of
yeah,
yourself. But let
yeah.
me ask you if there's anybody listening who
Huh?
might want to get a taste of what it's like to work the way you
Yeah,
work in a medical
yeah,
desert and have a
yeah,
really deep, meaningful career, what
yeah.
advice do you have for them? How to get a taste of it without
You, you
completely
know,
selling
you
their
know,
house and moving?
yeah. Number one advice: be unapologetically you. That's number one advice, because and two, always seek out someone to mentor, to shadow, who's walked that walk,
Mhm.
um or have a taste of what that journey looks like. So I always tell them to, hey, feel free to reach out. Anyone who wants to at PD Advocate is our handle on social media, or at gmail.com, PAD Advocate. And that gives you a sense of what it's like to practice in rural Mississippi. Because I'm not just seeking people to come here, right? This is occurring
Right.
in other areas. This is occurring actually not far from where you are. There are regions, even in Harlem, in New York, in different areas in the Bronx. There are places in Pennsylvania, both rural and
Mhm.
urban, where there are deserts. Even where there are not deserts, there are places where the amputation rates are even higher than some rural areas, predominantly in
Mhm.
those Black communities. And so, anyone who wants to understand what those cultures are, or what the interconnectedness that needs to occur, you need to understand what it's like to have that experience down here. And you want to make sure that you stay true also to keeping up with your not only technical prowess or technical skill set, because you want to be great at what you do. There are not going to be a lot of people to bail you out, right?
Mhm.
So you don't want to come and half whatever you want to do. You need to be great at what you do. You need to know that you're not a cowboy or cowgirl. So you stop when you need to stop and seek
Yeah.
seek help or refer patients out. But that interpersonal competence is very key. And so I think a combination of all that, and it will, will give you that kind of baseline foundation to see if that's for you. I think that we need to have something that gets all our pre-medical students or people who are interested in medicine to explore rural healthcare. Rather than doctors without borders, there should be doctors within borders.
Yeah, right. I
Yeah,
love it.
yeah, and they should be reimbursed for it. I think there should be incentives, not reimbursed, incentivized to do so in terms of forgiveness or what have you, because I think that's how we address the medical deserts
Yeah.
ultimately. And there should be policies in place to do so, not just for primary care or pediatrics, but also for specialty care as well. And that's how we bridge that gap.
All right, Felicia, thank you so, so much for joining me.
This has been fun.
Any last words?
Hey, listen, anyone who wants to learn about peripheral arterial disease, or anyone who has the risk factors for it, for those who are, basically Medicare of age, or Medicare, or is over the age of 65, or anyone who's less than 65 who's had a history of diabetes, high blood pressure, high cholesterol, nicotine use, or has had a heart attack or stroke, you need to get screened for peripheral arterial disease. 21 million Americans have it. It's preventable if it's treated on time with all the medicines we use and all the technological advancements we've made. There's a lot of hope out there. Take your socks off when you go see your doctor. Tell them to screen you. It's a simple test. If you are not getting screened, you seek a second opinion. And if someone offers an amputation for a strategy, you say, hey, listen, I need to see it out someone else who wants to actually give me a hope and time before you take off my legs. So that's in a nutshell, my awareness pitch. I always use that. And we need more bright minds like yourself and me in medicine. So medicine is a cool specialty to get into, if you really
It
want to do good
is.
and make a huge
And it
impact
is,
in
and
this
it's
world.
such a bright spot having you today and
Yes.
focusing on the flourishing and the thriving instead of I mean, I know I'm not to belittle the fact that so many people are suffering and burned out, but it's a spectrum and what we focus on grows. So I want to focus on you today.
Yes. Yes. Thank you. Every time
All
I think
right.
my feet are tired or my feet hurt, I always think of patients who have no limbs.
Oh,
And,
sure.
and it gives me a better perspective of some of the blessings that we have. And sometimes it's good to retreat and have introspection and perspective and then come back and decide. But definitely speaking to you today has been fun, and this has been a blessing. Thank you very much.
Thank you. And as usual, a big thank you to all of our listeners for choosing to spend your precious time with us. And I hope to see you again on the next episode of Reinventing the White Coat.
For this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at sharecoaching.com. Thanks for listening, and don't be afraid to live your best life.